Bismillahirrahmanirrahim. Students, we are going to start our a new topic, which is very important topic, but very small topic from our previous one, and only few concepts are present in this small topic. So let's start our topic, which name is infarction. So infarction, आपने बहुत सारी जगहों पर infarction सुना होगा. So let's discuss about infarction. First of all, you have to understand three different terminologies. Infection is a different terminology. Inflammation is different, and infarction is separate from other two, because infection is actually a condition due to any foreign substance, due to bacteria, virus, fungus, or parasite, etc. Inflammation actually is a protective mechanism. But we will discuss detail of inflammation soon. Infarction is actually a different condition. Infarction is actually a necrosed area due to obstruction. So we will discuss all aspects of this topic. First of all, you have to keep in mind objectives of our today's lecture. We will discuss about definition, effects, and we will discuss red and white infarction, and then we will discuss the factor that influence the infarction development. So what is infarction? Infarction is actually an area of ischemic necrosis caused by the occlusion of the vascular supply to the affected tissue. If occlusion, if obstruction in any area or in any or at any place in the blood vessel is present, then next tissue become hypoxic and ischemic, or next tissue suffers with the deficiency of blood, or with the deficiency of nutrients, or with the deficiency of oxygen as well. So for tissue become necrose, tissue become damaged. So necrosis starts in the tissue, this area is actually known as infarction. So infarction occurs due to the less blood supply, due to the low blood supply, and you can say if obstruction is present in the blood vessels, then other organs, then coming organs or tissues become damaged due to less blood supply or due to less oxygen. So most of them infarction are present in brain and heart. Brain and heart are common example of the infarction. Brain infarction is actually cerebral infarction, and heart infarction is actually myocardial infarction. Only within few minutes infarction can cause death in a patient. So it is not a very casual condition. It can cause very serious illness in a patient. So what are the causes of infarction? First of all, we have already discussed about the thrombosis. Thrombosis is actually the obstruction in the blood vessels. So in any or in obstruction in any blood vessel, or rapid obstruction in any blood vessel, can damage the next organ. Thrombosis can cause infarction or necrosis of coming tissues. Then embolism is also a form of thrombus, or also can cause act like thrombus. So embolism can cause infarction. Vasospasm, these all other are less common causes. Most common causes are thrombosis and embolism. Vasospasm, tumor, edema, vessel twisting, trauma, and entrapment in hernia sac. These all other very less common causes of infarction. Two common causes are thrombosis and embolism. So we have already discussed detail about thrombosis and embolism. So embolism and thrombosis can cause necrosis of coming tissues. This is actually a condition which is known as infarction. So we have discussed in embolism that these conditions can cause infarction in any tissues. Embolism can cause infarction in coming tissues. So we are discussing about infarctions. Actually, what is I guess you have learned about the infarction. So infarctions are of two types. First of all, a red infection, and the other is actually a white infection or pale infection. Red Why red infection is red? Because red infection is actually a red in color, and it's due to the presence of RBCs or infarction, or you can say it's a hemorrhagic infection. What is hemorrhagic infection? Infarction with the collection of blood, with the accumulation of RBCs. So most of the in most of cases is actually happens due to the obstruction of veins, due to obstruction in the veins, due to occlusion in the veins. So but rare cases are also seen in the case of artery, but common red infarction are observed after vein occlusion. So vein occlusion can cause red infarction because especially it occurs in those tissues which are loose tissues. For example, brain is very loose organ, and on the other hand, gastrointestinal tract is very loose in the form of structure, and on the other hand, lungs are also very fragile or loose structure. Liver is also a very loose structure. So most of them hemorrhagic or red infarction occurs in the loose tissue, because in these tissues, chances of RBCs to came out from the to come out from the blood vessels are high. So after obstruction in the vein, or after occlusion in any vein, these RBCs from blood vessels released into the tissue. So these soft tissue become rich with RBCs. So due to high concentration of RBCs, these tissues become red in color, and we can say it's a hemorrhagic condition. So in loose tissues, red infarction mostly occurs. These organs typically include dual blood circulation. So there are two things you have to keep in mind. First of all, most of those organ in which blood supply is dual. Dual mean two-sided blood supply present in any tissue. There are so in any tissues, so there will be a less chances of infarction in those tissues, because if one supply is occluded, then it will be compensated from the another supply, because two supplies are present. It cannot cause severe condition, it cannot cause infarction, because if a tissue is supplied by a two blood supplies, two blood vessels, two arteries, then there are chances के जो है देयर चांसेस के जो एक अगर ऑब्स्ट्रक्शन हुई है तो दूसरी क्या है, ब्लड सप्लाई प्रॉपर है. सो इस तरह इन्फेक्शन नहीं होता, टिश्यू सर्वाइव कर सकता है. बट दोज टिश्यूज लाइक टेस्टिस or another tissue is actually ovary. uh, these are actually organs with single blood supply. These are actually tissues with or organs with single blood supply. So those organs or tissues which have a single arterial blood supply are more prone toward the infarction, because if obstruction, if they have only one blood supply, or a single way of blood supply. If obstruction is present in the single way, then there are no chances, or there is no alternative way of blood. So so those tissues which are supplied with a single blood supply are more prone toward the infarction, or more prone toward the necrosis. So hemorrhagic or red infarction mostly occur in the organs if a both blood supply, if in tissues with dual blood supply, if both blood vessels are obstructive, then it can cause red infarction, or infarction grossly appear as wedge shape. Apex of lesion is towards the blood vessel, and base towards the base toward the surface. So wedge shape. Those in case of red infarction, necrosed area appears like wedge shape from apex of lesion. Apex of wedge is actually toward the blood vessel, जहाँ से blood release हो रहा होता है, वहाँ से क्या होगी, एपिक्स होगी उस wedge की, और दूसरी साइड क्या होगी, बेस होगी, जहाँ पर वो जो एरिया जो blood vessel से दूर है. So in case of white or pale infarction, which is actually caused by the occlusion of arterial blood supply in those organs which are actually solids like heart, kidney and spleen, there is a very difficult condition to for RBCs to move out from the blood vessel. There is a because of solid or because of the solid texture of the tissue or organ. So there is not an easy way for RBCs to came out from a blood vessel and called appears and organ remain white. So anemia or bale tissue infarction occurs mostly in the solid organs. These are referred to as white because lack of hemorrhaging and limited RBCs. So because if RBCs remain in the blood vessels even after obstruction, then necrosed area remain white. Necrosis after enzymatic digestion of the tissue remain white, which is actually shows pale infarction. So if we grossly, अगर हम इसको ग्रोसली देखते हैं, टिश्यू को कट करके देखते हैं, तो देन हमें कहते हैं हमें वेज शेप एरिया तो नज़र आता है विद हेमरेजिक बॉर्डर जोन. ऑल जो टिश्यू होता है वो पेल होता है, वो हेमरेजिक नहीं होता, लेकिन उसका जो बॉर्डर है वो सिर्फ हेमरेजिक नज़र आता है. सो दिस आर एक्चुअली फीचर्स ऑफ red and white infarction. There is a condition in which we can say a coagulative necrosis. Most of them, which type of necrosis are present in infarction? So coagulative necrosis are mostly have been observed in the infarction. And on the other hand, in those organs like brain is an exceptional organ. So in sometimes liquefactive necrosis is also present in liquefactive necrosis is also present in few organs like in brain. So necrosis type of necrosis is also very important in infarction. White or red infarction may be of two types. First of all, we can say blend infection or septic infection. What is septic? Sepsis क्या होती है? वो septic is actually a condition in which if a necrosed area become infected with any microorganism, any bacterial infection or other microorganism, then we can say this the necrosed or infected area is actually a septic infarction. If infection is present, if a necrosed area exposed to bacteria or any microorganism and infection starts, this is known as septic infarction. And in septic infarction, if any infection persists in the body, then inflammation and then chances of compensatory mechanism or chances of inflammation and fibrosis become high. So after a septic infarction are those infection in which infections are actually present, in which microorganisms are present and they are eating the necrosed area inside the body. On the other hand, what are the blend tissues? Those tissues, those necrosed infarction areas in which actually no pathogen or no microorganism is present and there is no infection is actually present, in only necrosis is present just due to obstruction, but there is no further or secondary infection is present in necrosed or infected area. So there are some condition in which like endocarditis are due to viridans. In viridin streptococci एंडोकार्डाइटिस जब उनमें होता है कि जिनमें एंडोकार्डाइटिस के पेशेंट होते हैं उनमें क्या होता है कि अगर विरिडन या स्ट्रेप्टोकोकाई की वजह से है तो वो इन्फेक्शंस की वजह से ना वो किल हो जाते हैं. सो तो एरिया जो है वो ज़्यादा इन्फेक्टेड नहीं होता, देन उसको भी हम ब्लेंड कहते हैं, ठीक है। सो बेसिकली ये जो टू मोस्ट इंपॉर्टेंट थिंग्स थी, रेड एंड वाइट इन्फेक्शन एंड ब्लेंड एंड सेप्टिक इन्फेक्शन. सो सेप्टिक इन्फेक्शन, those infection which are actually a necrosed area with infection with microorganism with changes in necrosed area due to activity of bacteria, viruses, fungi, parasite, etc. There are major three factors which can which can influence the development of infarction. So first of all, what is the what is the first factor? Anatomy of the vascular supply. Anatomy of vascular supply can cause infection, can damage, can influence infarction. And on the other hand, rate of occlusion, speed of occlusion, speed of thrombosis, speed of embolism is actually another factor. Tissue vulnerability of hypoxia, how a tissue can respond, how for how time, for how many time, or for how much time a tissue can bear hypoxic condition. For example, brain tissues cannot bear hypoxic condition of less more than 2 to 3 minutes, then there are more chances of infarction. So let's start the detail of the factor. Those are those organs which have dual blood supply are less prone toward the infarction, because if one blood supply gets occluded, then it can be compensated with the other blood supply. So those organs like lungs, liver, and lungs, because lungs are provided with two blood supply like bronchial blood artery and bronchial and pulmonary artery. So obstruction in any one artery cannot cause infarction. Both, if both arteries become obstructed, it can cause a red infarction in lungs. Similarly, in liver they are provided with two arteries, hepatic artery and the portal vein. So in our limbs are also have two or dual blood supply. But those which have a single blood supply or and arterial circulation like kidneys, spleen, they are more prone toward the infarction. There is a slight obstruction can cause severe effect or damage to or rate of occlusion. If occlusion, if a thrombus or embolism, if a occlusion is slow developing, mean if a blood vessel is occluding with slow speed, then body or blood vessels can compensate this condition, like in case of coronary arteries are very actually small arteries. If any obstruction is slowly developing in any coronary, in any single coronary artery, then it can be compensated from other coronary arteries by the by the increased supply of blood. So rate of occlusion, if a occlusion is rapid or sudden, then it can cause more damaging effect. But if a slow rate of occlusion, so it can sometimes it cannot cause any effect. So rate of occlusion is also matters. Those organs which can bear hypoxic condition for a long time can cause can become less damaged toward the temporary hypoxic condition. But our brain or our nervous system need continuous supply of oxygen, and without any even without any break, even for a minute. It means your brain needs your brain needs oxygen for proper functioning for 3 to 4 minute hypoxic condition can severely damage can cause severely damage to your brain. So in case of less oxygen supply, we need oxygen or we need oxygen rapidly due to we need oxygen because we have to save our brain cells from death or infarction, or we have to protect from our brain we have to protect our brain from cerebral infarction. On the other hand, myocardial cells or also can not bear hypoxic condition for a long time, but it can bear hypoxic condition for 20 to 30 minutes or more than for the brain. So these was all about the hyper infarction. Infarction is also a very important topic from UHS point of view. There are many small MCQs type questions are present in it. Most important things are red and white infarction and coagulative necrosis, liquefactive necrosis, and sepsis and septic infarction. So please keep in mind, and please, if you have any question, then you can ask me on WhatsApp or anytime. Take care.